Good morning, everyone. My name is Charles Allen. I'm the Ward 6 Council member and chair of the Council's Committee on the Judiciary and Public Safety. Today is Thursday, January 23rd, 2020, and we are in room 412 of the historic John A. Wilson Building. The time is now 9:50 a.m., and I'm calling to order this performance oversight hearing of the committee. Today, we'll be holding our fourth of 8 performance oversight hearings for agencies under our jurisdiction. Today's hearing will hear testimony from the public and government witnesses about the following 2 agencies: the Fire and Emergency Medical Services Department and the Office of Unified Communications. Public witnesses testifying on their own behalf will have 3 minutes to speak. If you're testifying on behalf of an organization, the first public witness to speak on behalf of that organization will have 5 minutes, and each subsequent witness will have 3 minutes. If you have copies of your written testimony, ask that you please hand them to my staff to my left, your right. The hearing record will close on next Monday, so if anybody has any additional information that they wanted to share, please make sure you get that in by next Monday. That can either be sent to us by regular mail, you can hand deliver it if you'd like, or you can email it at judiciary@dccouncil.us. Our first agency today is the Fire and Emergency Medical Services Department, or FEMS. The agency's mission is to preserve life and promote health and safety through excellent pre-hospital treatment and transportation, fire prevention, fire suppression and rescue activities, and homeland security awareness. The department is responsible for fire and life safety code enforcement, along with community-based education and prevention programs. Fire and EMS is also the lead first response agency for managing consequences resulting from natural disasters or other catastrophic events impacting the National Capital Region. All right, we're now going to turn to our government witnesses. So Chief Dean, if you can come up, and if there's any member of your team you want to bring with you, please feel free. And once you've got your team assembled here, we'll have everybody take our oath. So is there anybody else you want to have swear in at the same time? Thanks. All right, so we'll have everybody stand and raise their right hand. I have a hunch, Dr. Holman, you may answer a question as well at some point. All right, thank you. If you swear or affirm under penalty of perjury, the testimony about to provide the Committee on Judiciary and Public Safety is the truth, the whole truth, and nothing but the truth. All right, thank you all very much. Good morning, Chief Dean.
Good morning, Council Member.
Good morning. We'll have you start just whenever you're ready.
Good morning, Chairperson Allen, members, and staff of the Committee on the Judiciary and Public Safety. My name is Gregory M. Dean, and I am the Chief of the Fire and Emergency Medical Services Department. Thank you for inviting me to testify on behalf of Mayor Muriel Bowser on the activities and accomplishments of the department in fiscal years 2019 and 2020. To date, for those of you watching from home, my testimony is available on the department's website at fems.dc.gov. I'm pleased to testify today on our department's performance. My testimony will cover the following areas of focus: living our core values, engaging our workforce, taking care of our own, and transforming healthcare in the District of Columbia. Living our core values. Last week at our annual town hall meetings, we introduced our core values to our members. Taken together with our mission and vision statements, core values provide a context for who we are, how we hope to treat each other, our customers, and our public, and what we hope to accomplish in the future. By identifying our core values, we can incorporate them into the spirit of all our members, regardless of rank or position. In fiscal year 2019, we launched this effort by first surveying our members to solicit their feedback on what our core values are. Our department's participation in the survey was robust, 20% of our employees. A committee made up of members of all ranks and perspectives then reviewed the results of the survey and developed a recommended set of values which were vetted and approved by our senior leadership team. We call our core values the basics: bravery, accountability, service, integrity, compassion, and safety. Of course, our department has demonstrated these values throughout its history. Now that they are formally adopted, we will be intentional about how we live our values with everything we do. Engaging our workforce. Developing our core values was one step in our efforts to engage our workforce in accomplishing our broader mission. Another of the department's strategic initiatives in fiscal year 19 was to institute an employee engagement process to foster greater awareness and buy-in of the department's performance plan and big picture goals with sworn and civilian members. The senior leadership of the department was featured in videos describing the department's priorities, which were released to the membership throughout the year. The videos included topics like employee mental health and wellness, standardized recruit training, and development in the department's Right Care, Right Now nurse triage line. This past summer, the department's leadership team also formally engaged mid-level managers in the development of our fiscal year 2020 performance plan. And the final product was heavily influenced by the feedback received during that process. This process also reflected our commitment to developing future senior leaders of the department from within our ranks, work that will continue in fiscal year 2020 as we provide professional development opportunities for our chief officers. This work caused us to look inward as an organization and to ask, how can we improve working conditions in the department? And if we are successful, will those improvements lead to better service for the residents of the district? Taking care of our own. These questions have guided our priorities for fiscal year 2020. Those priorities include improved employee wellness, making our logistics division more customer-focused, evaluating our information technology capacities and needs, optimizing fire suppression and fire prevention operations, and ensuring ready apparatus. Last year, we testified about our launch of a new peer support program designed to support our employees' mental health needs. This effort went beyond our previous program, which was incident-based and did not always recognize the cumulative stress caused by our work and the role of officers and peers in recognizing those signals of stress. We're continuing to improve the peer support program in partnership with our labor unions in fiscal year 2020. We will also develop a more comprehensive and sustainable employee wellness program that will measure members' health and time loss savings over time, create a dashboard for accident and injury submission and tracking, and expand the O2X Human Performance Program to support our members' physical and emotional wellness. We've heard from our members about the challenges they face in ensuring we have enough supplies to operate daily, as well as ensuring that their facilities remain safe and comfortable. These issues impact our ability to provide the best service possible to our residents. In fiscal year 2020, we are making our logistics and facilities division more customer-focused by improving communications, transparency, and accountability with our field provider customers, reviewing and revising warehouse processes and procedures to strengthen efficiency, service, and daily inventory, and strengthening our collaboration with our Department of General Services to improve our members' living and working conditions in firehouses. This work follows our successful effort in fiscal year 2019 to procure new self-contained breathing apparatus for our members, as well as capital budget enhancements to modernize or replace engines 15 in Anacostia, 23 in Foggy Bottom, 26 Brentwood, and 27 Deanwood. Up-to-date information technology also ensures our effective delivery of services. In fiscal year 2020, we are assessing our information capacity department-wide, while also refreshing our hardware and software within our existing budget. The best way we can take care of our employees is to ensure that they are safe while doing their most dangerous work, fire suppression. In fiscal year 2020, we are working to protect our members' safety by implementing and expanding operations safety initiatives and company-level training requirements. We're also working to improve both the effectiveness of our fire prevention division's inspection efforts and company-based building inspections, as well as strengthen fire prevention's training and collaboration with the Department of Consumer and Regulatory Affairs. This work follows our efforts in fiscal year 2019 to provide new multi-company fire evolution drills, expanded incident command training, and new leadership training with the launch of our new Supervisor 3 courses for captains. In addition, in fiscal year 2019, we certified 495 members in the prerequisite courses under the National Fire Protection Association 1002 standard for the Fire Apparatus Driver Operator Emergency Vehicle Operator course and Traffic Incident Management Safety. 27 members processed through the full Fire Apparatus Driver Operation course. The Training Academy is committed to continuing the certification process from our members throughout fiscal year 2020 so we can meet and exceed the NFPA standard. We're also continuing our Empowering Women to Lead program with our third mentee class starting this year. We know with this work, we have demonstrated that our department is a welcoming place for women. Approximately 25% of our new exam registry list is made up of female candidates, almost double the percentage of women currently working in our operations division. Of course, we cannot do any of this work without having ready apparatus available to respond to calls. Last year, our testimony was heavily focused on our apparatus division. I am pleased to report today that this division made substantial progress in fiscal year 2019. We did so by restructuring the division's management and schedule, putting into service 6 new engines, which helped to create a larger reserve of engines, which in turn improved engine uptime, outsourcing our parts operation, improving staffing levels, and delivering significant level of training for our mechanics and supervisors. We're taking delivery of 7 new ladder trucks this calendar year, all of which are expected to be in service by the end of December. Our priorities for fiscal year 2020 are to establish and maintain a consistent reserve fleet capability across ambulances, pumpers, and ladder trucks simultaneously. Continue to work towards personnel meeting qualification goals in accordance with our National Fire Protection Association NFPA 1071 standard for emergency vehicle technician professional qualifications, and perform preventative maintenance on all assets at all required intervals. Transforming healthcare in the District of Columbia. In fiscal year 2019, Mayor Bowser launched the Commission on Healthcare Systems Transformation. We were honored to participate in this commission, and I served as the vice chair of the Committee on Emergency Room Overcrowding and General Reliance on Inpatient Hospital Care. A major emphasis of the commission's report will be to provide recommendations designed to give patients greater access to health care, including non-emergency services for patients who currently use emergency room departments for their primary care needs. We anticipate that implementation of the Commission's recommendations will improve patient outcomes and further support improvements in the district's emergency medical services system. The Commission's report follows the innovative work of the department and our health and human services partners with the launch of the Right Care, Right Now nurse triage line in April of 2018. As this committee knows, this program transfers 911 callers with minor injuries and illnesses to a nurse who assesses the patient and then refers eligible patients to either self-care or to walk-in appointments at neighborhood clinics using non-emergency transportation. Our goal with this initiative are twofold. First, to get patients with non-emergency conditions to more appropriate health care than hospital emergency rooms. And second, to preserve the department and hospital's resources for those patients with life-threatening illnesses and injuries. After almost a year into implementation of the program, in March of 2019, we launched the field provider referral phase of the nurse triage line. During this phase, our field provider began referring patients to the nurse from the field. The benefit of the field provider referral is that our providers can assess the patient in person and evaluate patient with vital signs. We then share that information with the nurse triage line nurse to assist in their decision making about the best destination for the patient. After implementation of the field provider referral phase, we added an additional transportation option for patients with no insurance or private insurance. Previously, only Medicaid and DC Alliance patients were eligible for non-emergency transportation. During the first year of the nurse triage line, the number of patients referred to the program was lower than we anticipated before the launch. We are pleased to report that in recent months, the number of non-emergency patients being diverted from the EMS system has gradually increased. We believe this is due to the nurses' increased experience in diverting patients from emergency departments. It is also due to our field providers increasing use of the field provider referral process. Comparing the first 6 months of calendar year 2019 and the second 6 months of calendar year 2019, while the number of calls referred to the nurse triage line went down, the number of callers referred to the clinics increased by 235%. And those referred to self-care increased by 149%. Field provider referrals to the nurse triage increased from fiscal year 19 quarter 3 to fiscal year 20 quarter 1 by 430%. Overall, since the start of the program, we have diverted over 3,600 patients from the EMS system and into more appropriate care. As part of our efforts to engage our members in the importance of the program, we recently started releasing videos in which our employees talk to their peers about nurse triage line. We think that there are no better people than these men and women who have spent years operating in a system that has long been challenged by larger healthcare system issues. The following is a short clip of their comments.
It benefits the patient because she can be seen a lot quicker through the clinics or urgent care or something like that, as opposed to waiting in the ER for hours and hours and hours if the ER is busy. It helps the department because you're not, for lack of a better word, wasting resources on patients that don't require emergency services.
They seem to think that nurses have a better grasp on healthcare than EMTs and paramedics, and to some extent they absolutely do. So when you tell a patient, hey, can we speak to a nurse? Because they're used to going to the ER or urgent care and asking for a nurse, and the nurses are typically the ones to help them in that time of need, versus us, who when we turn them over to an emergency room, they're talking to a nurse. So when I tell them, hey, would you like to talk to a nurse? They're like, okay, this is what I'm accustomed to. Just this is over a phone as opposed to in person. And having the confidence that a nurse gives seems to put a lot of the patients at ease.
Big picture, this is transforming healthcare, and it needs to work. And it has worked, and it can work, and it will work. It's just about getting buy-in from patients, other healthcare clinics, and other healthcare agencies that are affiliated with us. I think if we can do that, then we can have a higher success rate.
In closing, I would note that at its core, the nurse triage line is about proper patient assessment. It allows our members to use their medical training to practice medicine and to get the patient to the healthcare destination that best serves his or her needs. Of course, we remain focused not just on diverting non-emergency patients, but also on leveraging these innovations so that we can provide the best care possible to all our patients, including those with life-threatening injuries and illnesses. For these reasons, in fiscal year 2020, we will double down on our efforts to improve patient care and patient outcomes. We will do this by updating our training policies and supervision surrounding patient assessment and referral of patients to AMR. Improving our process for mentoring new basic life support for our providers, strengthening our supervision of BLS, basic life support care, and implementing a hospital data exchange program to evaluate all patient outcomes. Mr. Chairman, this concludes my testimony, and I'm happy to answer any questions that any members of the committee may have. But prior to that, could I read in this legislation for the Fire and Emergency Medical Services Command Staff Amendment?
Sure, absolutely.
Good afternoon, Chairperson Allen and members and staff of the Committee on the Judiciary and Public Safety. This legislation was introduced by Chairman Middleton at the request of the mayor on December 6, 2019. If enacted, the legislation would amend the District of Columbia's government's Comprehensive Merit Personnel Act of 1978 to clarify that the fire and emergency medical chief, as delegated by the mayor, is authorized to promote assistant fire chiefs from the rank of deputy chief or battalion fire chief, deputy fire chiefs from the rank of battalion chief, and battalion fire chiefs from the rank of captain. The legislation also permits demotion to the members' prior rank or to the rank of captain. The executive proposes legislation to clarify existing practice, allowing the fire and EMS chief to promote chief officers, battalion chiefs, and above, from the rank of captain and above at his or her discretion. The department's chief officers are the only senior managers left in the government who are considered career service employees, which means that extensive documentation of cause must be established before they can be demoted or disciplined. This legislation modernizes the fire and EMS department's senior management structure, bringing it in line with the policy and practice of the rest of the district government. Sound management practices dictate that the fire chief have authority to exercise his or her discretion with respect to senior levels of the department's command staff. Clarifying this authority in the law will modernize the DC code as it applies to our department and give the fire chief what we believe is the appropriate amount of flexibility and discretion in his management of the department's non-union management team. Similar authority was granted to the chief of Metropolitan Police Department in 2000, consistent with the CMPA, for accepted services and management supervisors, service employees, and other executive agencies. This bill, however, would maintain our members' career service rights at the rank of the captain and below. So unlike accepted service and MSS employees, chief officers could be demoted to the rank of captain, but not terminated at the discretion of the agency director. The ranks impacted by this proposal are non-union managers and thus are outside the scope of the department's collective bargaining agreements. In developing this legislation, the department worked with DCHR, which concurred with the department's determination that legislation is required to proceed with this policy goal. The department also notified the International Association of Firefighters, Local 36, and the District of Columbia Chief Officers Association. Prompt consideration of this legislation will allow department administration the ability to more efficiently choose from chief officer ranks for promotions and to make management decisions without unnecessary detriment to an officer's career and reputation in the event of a return. Mr. Chairman, this concludes my testimony, and I'm happy to answer any questions.